STDs, or sexually transmitted diseases, are infections transmitted through sexual contact. They may be transmitted through any kind of sexual activity. There are misconceptions galore about STDs, sexually transmitted diseases. While many dismiss the possibility of ever contracting one since they don't have multiple partners, there are several who are quick to assume that they don't have one, since there are no debilitating, life-threatening effects. However, whether the signs and symptoms are obvious to you or not, you definitely need to know when to check for one so that you're not putting either your partner or yourself at risk. Here are 8 STDs that all men should know about. Chlamydia. Chlamydia is a bacterial STD that is transmitted when one has oral, vaginal, or anal sex with a person who has chlamydia. One of the most common sexually transmitted diseases in the world, this infection often doesn't even manifest symptoms in many people, while in some others, it may take several weeks to show. Some of the common symptoms that men affected with chlamydia show are pain when urinating, penile discharge, and swollen testicles. The reason this is a persistent problem is that, even though symptoms disappear, the infection still remains, putting both partners at risk. Therefore, the infection needs to be treated at the earliest. Gonorrhea. Gonorrhea is a bacterial infection that can affect the anus, throat, or urethra. It is transmitted through anal, oral, and vaginal sex with an infected person. While most men with the disease don't display any symptoms at all, some do, which include pain when urinating, a green, white, yellow discharge from the penis, and swollen testicles. Treatment often given for gonorrhea is also curative for chlamydia, as both these diseases usually occur together. Trichomoniasis. Many men and women infected with this don't even display symptoms, and as with chlamydia and gonorrhea, may not even know that they are infected. In case it does not manifest itself in symptoms, it typically causes urethritis, itching or burning, and discharge from the urethra. HIV. The human immunodeficiency virus is perhaps the most feared STD in the world, and justifiably so. While sexual contact is one of the prime factors as in all other STDs, HIV, however, can also be transmitted through sharing of needles, or from an infected pregnant woman to her baby. The virus ultimately causes dysfunction of the entire body's immune system at a later point in time. The time taken to go from infection to immune dysfunction is usually about 10 years. Sans any specific symptoms, HIV can manifest itself in the infected person through fever or flu-like illness, which surface 2 to 4 weeks after contracting the virus. Today, numerous medications are available to help people manage the infection and stall or delay the illness. Herpes. The herpes simplex viruses cause painful, blistering sores on exposed parts of the body and are transmitted through any kind of sexual contact. Like in other STDs, it is possible for people with herpes to not display any symptoms. In men, the sores can be found on the penis, buttocks, scrotum, anus, inside the urethra, or on the skin of the thighs. The sores of oral herpes occur on lips or around the mouth and can be spread through kissing. HSV infections are not curable and persist for life. Outbreaks can be soothed to an extent by antiviral medication. Genital warts. Human papillomavirus infection (HPV) is a common STD. While some cause genital warts, however, certain cause common warts that are not STDs at all. It is believed that over 75% of sexually active people have been affected with genital warts. Symptoms, if they do occur, include lesions which appear as soft, flesh bumps on the surface on the anus or penis. While vaccines and treatment to remove warts are available, the body is usually known to cure itself of the HPV infection. Hepatitis B. Caused by the hepatitis B virus HBV, hepatitis B is particularly dangerous because, unlike the other STDs, which cause certain common symptoms around the genital area, this STD can cause inflammation of the liver. One can contract HBV by coming in contact with the blood or bodily fluids of a person who has the infection. Common symptoms include loss of appetite, low-grade fever, nausea and vomiting, muscle and joint aches, and jaundice, yellow hue to the skin, and dark-colored urine. Syphilis. Syphilis is a bacterial STD that can be transmitted through anal, oral, or vaginal sex. Syphilis may set in through 4 stages. If the first isn't treated, secondary syphilis can develop, causing the infection to spread to other organs. After this stage, some people may develop a latent infection for years, finally resulting in tertiary syphilis, which can cause brain infection, loss of sight, and deafness. Fortunately, syphilis is curable with proper antibiotics. Ultimately, when you're slipping into the sheets for a night of frenetic sexual activity, STDs are the last thing you want to think about. Make sure with this list that you don't have to. Please note it is important for anyone who is sexually active to go for STD tests every 6 months, especially if you have multiple partners or have had sex without protection.